When you are in a relationship or find that special someone and you are both ready to take things to the next level, it is important to know what your options are for protection. It is not only important to know what your options are, but also know how to properly use them. The male condom is probably one of the most popular forms of birth control around. They are fairly inexpensive and are 97% effective in protecting against pregnancy. They are also used to prevent the transmission of HIV and/or STDs. There are two types of condoms, either latex, which is the most common, or a lambskin condom. The proper usage of this device is done by a man placing it onto himself before sexual intercourse. Proper application must be followed in order to maximize the effectiveness. The downside to the male condom is that they can break while intercourse is taking place. If this were to happen, a second form of birth control will be needed to follow immediately, such as the morning after pill or other oral birth control pills. Another form of condom is the female condom. This is worn on the inside of a female and works similarly to the male condom. There are some disadvantages of this device. Sometimes if vigorous intercourse takes place, the female condom can easily shift and/or fall out altogether. This could raise great concern for the risk of contracting HIV, STDs, or even becoming pregnant. The female diaphragm is another form of birth control that can be used by a woman. It is a latex-shaped cup that blocks the cervix, preventing sperm from implanting. The diaphragm can be inserted before sexual intercourse, and it should remain inside for at least 6 hours after the act. This is important in order to prevent pregnancy from occurring. A diaphragm should not be kept inside for more than 24 hours at a time. The cost for this device can range from $15 to $25. An intrauterine device is a longer-lasting form of birth control that can be inserted into a woman's uterus by a healthcare professional. It is a T-shaped device that comes in either copper or one that contains hormones. The IUD can be left inside of a woman's body anywhere from 5 to 12 years. If a woman decides that she wants to have children, the device is simply removed by a healthcare professional. The cost for this device is very expensive and can range from $500 to $1,000. Probably the most common form of birth control besides the male condom is the birth control pill. As stated by the medlibrary.org, birth control pills contain a combination of hormones that prevent ovulation, the release of an egg from an ovary. The pill contains a form of estrogen and a form of progesterone, which are both female hormones involved in contraception. There are a variety of pill forms, but they all work in the same exact way to prevent against pregnancy. They are hormone-based pills with 3 weeks of active pills and 1 week of inactive pills. The active pills contain hormones and the inactive pills do not. They simply serve as a reminder pills so that a woman can remember to take them. The pill must be taken at the same time each day in order to provide maximum effectiveness. A backup method, such as a male condom, should be used if a person has forgotten to take their scheduled medication. One of the most convenient forms of birth control is the hormone shot. This shot is administered by a healthcare professional every 3 months. This only protects the person from getting pregnant, but not from HIV or STDs. The shot is known to be 97 to 99% effective in preventing against pregnancy. The only type of birth control that is 100% effective is abstinence. Abstinence is refraining from any form of sexual intercourse. It is a personal decision that one makes to either save themselves until marriage or for religious reasons. Nonetheless, this is by far the only way a person is fully able to protect themselves from becoming pregnant and/or contracting HIV or STDs. Abstinence is not for everyone, but if this is an option, that does not require a cost or hormonal interference. When deciding that you and your partner are ready to take the next step, it is important that you talk to a doctor and/or pharmacist. As stated in the New York Times Magazine, confronting medical issues can be difficult. And that is why they have supplied a list of questions that you can take with you to the doctor. Your health and your health of your partner is an important fact. Do not hesitate to ask. They will give you the facts without making you feel uncomfortable. It is important that you take charge of your sexual health and knowledge. Become informed. For more information, please visit www.familydoctor.org and/or www.plannedparenthood.org. Thank you.